Hello, my name is Jordan Stewart, and this is my PSA on chlamydia. Chlamydia is the most prevalent sexually transmitted disease. It's a bacteria that affects the reproductive system. It's spread through sexual contact, and according to the World Health Organization, 131 million new cases occur each year. What are some of the myths that people say about chlamydia? Your body will get rid of chlamydia naturally. Once you've had chlamydia once, you can't get it again. You're going to build up immunity to it. Or you can't get chlamydia if you've only had one sexual partner. Well, hate to break it to you, but these are myths for a reason. Your body needs antibiotics to get rid of the bacteria, chlamydia. It cannot naturally fight it off. And you don't build up immunity to chlamydia. You can be re-exposed several times. And unfortunately, even with just one sexual partner, there's still a chance of getting chlamydia. Now that we've talked about the myths, let's talk about the facts. Chlamydia can affect anyone. Women, men, gay, or straight. It doesn't matter. Chlamydia is an equal opportunity STD. It affects mostly those under the age of 24, with this being the highest prevalence rate. Also, chlamydia is a curable STD with antibiotic treatment. In comparison to men, women have higher rates of chlamydia, especially the African American female population. Their rates of chlamydia are 5.7 times higher than those of Caucasian females. So why is this? Well, some African American females have trouble or difficulty seeking health care due to prejudices or social stigmas associated with their race. They fear the provider's not going to provide them with proper care, or they're going to judge them. Also, they may be uninsured, or they may not have proper access to health care. So, who all needs to be tested? Pregnant women should be tested, as well as men who have sex with men and any high-risk individuals. Current guidelines for screening for chlamydia by the CDC recommend that women who are sexually active and under the age of 25 be tested, as well as those who are over the age of 25 and at high risk should also be tested annually for chlamydia. All pregnant women should be tested upon initial examination and in their third trimester if they're at high risk or under 25 years of age. Men who have sex with men should be screened annually, or even more often every 3 to 6 months if they're at increased risk, such as they're having multiple sexual partners or they're not using condoms. The U.S. Preventative Service Task Force recommends screening starting at age 15 up until age 65. First-line treatment for chlamydia includes a 7-day course of doxycycline or a single dose of azithromycin. Now, this is only if you're not pregnant. If you are pregnant, you're going to want to do azithromycin as your first choice. And second-line therapy includes amoxicillin. What can we do as future nurse practitioners? For starters, we need to encourage following evidence-based guidelines for screening in primary care. We need to make sure we're reducing stigmas associated with STD screening, making all of our patients aware that it is normal and they need to be getting it done annually if they're at high risk or if they fall within that category. Following treatment guidelines for those who test positive is of utmost importance. Patients need to be educated that they do not need to have any sexual activity during the course of treatment, as well as their sexual partners need to be treated as well. We need to offer non-discriminatory care and have our patients know that we have an open environment and an open mind to everything they're going through. Providing patients with educational resources such as when to be screened or how to use a condom. These are important facts we need to be letting our patients know about. Make sure you're educating your patients about condom use. This is going to be one of the best preventions against chlamydia. Well, that's all, and I just want to thank you for listening to my Chlamydia PSA.